Good morning. Hi, my name is Nancy Mason. I'm the director of the Mvskoke Nation Youth Services Program. I'm so glad that you guys are here joining us today. I want to talk just a little bit about our youth services program. So, our mission is to empower Mvskoke youth by connecting to culture, community, and resources. We do this through several program goals that you can see there. Fostering advocacy is one of those goals, where we work with our young people around leadership opportunities. We have a youth council through our program. We also try to foster advocacy. I'm sorry, going on the next one, provide resources. So we do that through our website. We have a resource book, and we also try to provide as much information online as we can about resources and opportunities. Promoting civic duty is also something that's very important to us, trying to get our young people engaged in the political system and letting them know that their voice matters. Encouraging wellness is probably the biggest component of our program. Most of our services fall under this area. We try to promote the concept that culture is prevention. And so doing a lot of cultural activities and just overall wellness that focuses on both mental and physical health. And then lastly, but not least, is creating support. We recently started a mentoring program that we've been piloting in the Wetumpka area, and it's something we'll be continuing next year. But that creating support happens in a lot of different areas. And with all of our program goals, we do try to advocate awareness about things that are going on. Today is Children's Mental Health Day, and the month actually will be dedicated to that cause also. So today we wanted to bring in two of our friends from the Behavioral Health Program to talk a little bit about Children's Mental Health Day, and then also the COVID-19 crisis and how you can work with a young person that might be dealing with some stress or anxiety around that. So I want to go ahead and turn the presentation over to Rush Williams with Behavioral Health, and he's going to introduce himself. I also have Tyler Stone online, and he'll be presenting in just a few moments. So Rush.
Good morning. So my name is Rush Williams, and I work for the MSPI Prevention Grants. I'm the project director, and what MSPI is, it's a suicide and substance abuse prevention grants. And we'll go ahead and get started, and we're going to talk about what is Children's Mental Health Day and why it's important. All right, sorry about that. So Children's Mental Health Day. So it was actually created by SAMHSA to shine a spotlight on the importance of caring for every child's mental health. And then it was also created to reinforce the message that positive mental health is essential to a child's healthy development. Raising awareness of the importance of mental health and substance use services for children, youth, young adults, and their families. The second key strategy is to demonstrate how children's mental health promote positive youth development, recovery, and resilience. And then lastly, this day was just created to show how children, youth, and young adults, even with mental health and substance use disorders, can recover and then flourish in their communities. So this day is important to let everyone know that mental health treatment is available. And then also too, it is to recognize that, stigma is associated with mental health problems sometimes. So oftentimes if somebody breaks their arm, they typically always know where to go. They know to go to the emergency room or follow up with a doctor. But sometimes with mental health, people can be kind of unsure about where to seek those mental health treatment avenues at. But one thing to remember is that mental health is just as important as physical health, and mental health resources are available. And then the sooner an individual gets help, the more likely they are to have a positive outcome. And I wanted to share that with you because one kind of fact is that 50% of all lifetime mental health problems, you can actually start seeing symptoms by the age of 14. So whenever we think about our middle school and early high school, some of our students may have already been experiencing some type of symptoms or reactions, or just, even kind of behaviors that can be alarming. Another thing too is that 1 in 8 children and young people have a diagnosable mental health problem. And we wouldn't really always think about that because mental health isn't typically always reported, as broad and open and everything. But the good news is that we're really starting to make more of an effort and uh, make more of a change within mental health and mental health treatment. So what I want to do next is I just want to talk about some of the warning signs and just kind of some of the behaviors and some of the potential signs and symptoms of whenever a child or young person or even an adult is struggling with mental health issues. So one could just be their mood. So has their mood changed drastically? Are they a very happy person and outgoing? And then all of a sudden for the last week or two or the last month, have they, kind of been down? Or the opposite, if somebody is very calm and everything is usually just kind of smooth and easy going, and then all of a sudden they just kind of start acting differently. Because we can typically see a change whenever we spend time around a certain person. The next one could be irritable. Maybe they're just extremely irritable about even the smallest little things, and sometimes you kind of wonder, why this is bothering them so bad. And we're not going to go through all these, but the main thing is this person feel stressed? Are they experiencing a lot of stress? So much stress that they're even lacking self-care? Are they having a hard time getting out of bed? Are they having a hard time getting up and brushing their teeth or brushing their hair? Or are they even having a hard time going places? And I know right now this is a little bit different, and schools are out, and we can't go to our favorite restaurants as much and those type of things. But even as these start opening up, this is where our social engagement really has to increase by continuing to offer support, offer care, and then even connect with each other in all these safe avenues that we can. So that means calling an old friend, sending a text message, just connecting with your neighbor even through the yard, and just waving at people, and those type of things really go a long ways in helping somebody who could be struggling with a mental health issue. But to sum all of that up, you can ask yourself, is a young child, are they struggling in school? Are they struggling in their social settings? Are they not, participating in birthday parties or even, just different things like going to the grocery store or going to the church or things that they typically do? And then lastly, their daily living activities. So typically when we have a child in the home, we can kind of figure out most times what we need to do. We probably need to wake up at a halfway decent, reasonable hour. As long as you don't have work, then you need to really wake up. But try to make sure that they don't lay in bed all day. Try to make sure that you can get them up, and then see if they can go ahead and change their clothes and take a shower and kind of brush their teeth and start their day right. Drink some water, and then see if you can kind of get them into a routine. See if you can even encourage some exercise and have them do some schoolwork, and just kind of keep them busy and active. And then also, try to incorporate some fun stuff and of the activities and hobbies that they already like to do. So this next slide is going to be about what is normal behavior and what's something that, we just need to become aware of. So for typical adolescents, withdrawing from family to spend more time with friends is normal. We don't always want to hang out with our parents or our siblings or sometimes our cousins. And that's okay if they're going to spend time with their friends. But if you start seeing them withdraw from their friends, family, and any social activity, that's when we should, just become aware of that. The next one is wanting more privacy. So this is also normal too for any adolescents growing up, even for any adults as well. Most people want their own vehicle, they want their own cell phone, they want their own room, and that's okay. But if it seems like they're becoming secretive, and you feel like they are trying to hide something, that's when we should become aware of that. And then moving from childhood likes to teen pursuits. So this is also normal. And what this means is basically if they've really enjoyed something or enjoyed a hobby or even enjoyed Legos or a certain TV show whenever they were in middle school or even in elementary, well, they're not going to like all the same things that they will once they get to high school or once they get to college, and that's okay. But if it seems like they're losing interest in their favorite activities and they haven't been replacing it with any other thing, that's when we should try to be aware of that situation, especially if you see one or two of these or all three. So what can we do? What can we do as adults, not only in our household, but just in the community as well? So one thing that we can do is we can always recommend self-care strategies. So what this can look like is exercise. So what we know is that exercise actually really helps our mental health because it allows us to release dopamine, and we're not going to get into all of the biology of it, but it makes you feel better and it makes you feel a sense of accomplishment. And the next thing could be healthy diet. So our food is fuel. What we eat is how we feel. And whenever we think about a healthy diet, we need to make sure that our youth especially are drinking water, drinking not very much soda, making sure that we're eating fruits and vegetables, and just a good, clean, healthy diet. And you can snack here and there. But we got to make sure that we're getting in all the proper nutrients. That way, not only their body grows, but their brain grows too. Another thing is sleep. So I know when I was a youth, I didn't sleep very much, and it really did have an effect on me. So I remember that whenever I was in cross country, my coach was like, "You're not running very well. What time are you going to bed?" And I said, "I don't know, around midnight or 1." He said, "Well, you need to go to bed earlier." And it's funny because as I started going to bed earlier and earlier, around first it was 11, then it was 10, and then it was 9, I actually improved a lot by the time that at the end of the season. So making sure that we are encouraging 7 to 9 hours of sleep at least for these students, and really if they're somebody younger, maybe 8 to 10 hours. And then the last thing is stress management. So this is where mental health really comes in. We have to find ways that we can manage stress instead of, becoming irritable or even just angry. So find some ways that help that person. So everybody's different. Everybody's stress management is going to look different. So if I go to a school and I give 5 or 6 presentations back to back, if I get a break of any time throughout that, I typically just get in my car and I drive around. Not really doing anything, not really going anywhere, but I'm just trying to get away from the office a little bit, or getting away from wherever I am, and just try to, calm down and listen to some music and then just drive around. And that's how I manage my stress. But, if you are seeing a lot of these signs and symptoms in children, and maybe we've recommended a lot of these things and a lot of these self-care strategies such as exercise and sleep and all those things, and maybe you're still kind of concerned, one thing is to see if you can go ahead and have a conversation. See if you can have a conversation with that young person. And a few ways that we can do that is to, one, be genuine. So kids oftentimes know whenever you're not being straightforward with them. And also, too, kids want to be respected. So even though, depending on whatever age a person is, they still want to feel like that they can talk to you and they want to be respected. Another thing that we should be careful of is about using slang or sarcasm. So kids don't always, and adults as well, if somebody is having a mental health issues, they won't actually react to sarcasm as well, because at that time they might think that you're actually being serious, and at that time they can't really tell a difference. Another thing too is be comfortable with silence. So if you ask a question and they don't respond immediately, maybe it's just taking them a little bit. And actually, something about trauma, if somebody has experienced trauma, their processing whenever they're having discussion can actually be a little bit delayed. The next thing is be in the present without comparing to your own youth. So obviously 2020 is a lot different than it was in 2000 or 1980. So be aware of that and just try to be understanding of that. And then be aware that a young person's feelings are real. So even though that they are 10 years old or 14 years old or 20 years old, their feelings are real, and they are oftentimes different than even their siblings, or they're different than their friends, and ultimately different from their parents. And then be aware of your body language and your facial expressions. So make sure that you are keeping a positive body language. And even if, this is somebody close to you, if they say something that is very alarming, see if you can just try to remain, a neutral facial expression, That way they don't feel like that they just overwhelmed you. So you want to be that person that they can talk to. And one way that we can do that is try to be positive with our feedback. And we can also just try to be helpful with them without telling them how they should feel. But if you're seeing all of these warning signs and your conversation didn't really go well, and maybe you're still kind of concerned, well, one thing that you might do if you're their guardian is just reach out to somebody, reach out to a professional, reach out to our behavioral health services in case that, you feel like that they would just benefit from coming in and being a part of an assessment and maybe even needing treatment. And then even if you're just a close friend with somebody, see if you can reach out to somebody, see if you can reach out to their parent or their sibling or their brother. And then another thing too is to encourage your children to talk with you about that whenever they start feeling a certain way. And last couple things is to encourage self-help and other support strategies with that person. So identify others who may be helpful for this individual, and then explore activities that might help manage these symptoms, and then find strategies that interest the young person. Because if somebody doesn't like something, then they're not going to want to do that. So see if you can find something that works for them. And then also discuss these strategies potentially with a health professional if that's what's needed. And then also to engage the family as well as the young person. So even if this isn't somebody in your own family, maybe it's a brother of yours or a sister of yours, and they have a family, a big family or a little family. But see if you can engage them to, include some of the other siblings and some of the other parents, whoever it is involved. Try to find the whole family around them as a whole, and then with everybody together, you can start making a difference. And whenever we talk about children's mental health, the main thing to remember is that talking about mental health awareness and mental health treatment for our kids, to our kids, is to know that it's okay to reach out whenever they're feeling blue. And then if we do, we can create a culture that accepts mental health prevention and treatment. And so I hope you learned something on that. And then now I'm going to turn it over to Tyler. Well, actually, Nancy, I think that we actually lost Tyler.
I saw that he is trying to get back on. I wanted to go ahead and open up to questions. If anybody in the audience has questions, you can enter those in the Q&A or in the chat, and we can answer those for you right now. Tyler is going to be talking more about some of the COVID-19 resources, and we have several of those that we can share with you too. I wanted to go ahead. We're going to have these documents on our website pretty quickly for you all after the presentation today, so that you'll be able to have copies of each of these documents if you'd like to go there and download them. But I'm going to share them with you real quick so you can kind of just see what they have available. And this one's actually, hold on, that's not the right one. There's a coloring book. Let me pull that up for you guys first. Rush, have you looked at all of these documents too?
Yes, I've looked at most of them, and we actually created the very last one. And so what we tried to do with that, the one that says wellness, activities, games, and ideas,
Yeah.
what we tried to do with that was to tie in some of the coping skills and some of the strategies, and then also kind of tailor it to our own behavioral health program. So.
Great. And I just glanced at these a little bit too before the presentation, and they definitely look like something you could do at home really easily with your child. I like how you guys put these together. I know we also have information on the program that we're going to be talking about. Do you want to tell us a little bit about behavioral health and just kind of what services you guys offer and how people can connect?
So we have a variety of services, and ultimately, it kind of depends also too on age, and then also kind of where you're coming into treatment at. For instance, we have an SBIRT program. So SBIRT is it's inside the clinic. So anybody over the age of 18, participates in a screening, and what that screening talks about is substance abuse disorders, and then also to eating, mental health, and then how it can be combined. So basically, if somebody comes into the clinic and maybe they're saying that they have about 15 drinks per week or 20 drinks a week. What that will actually do is they'll actually meet with, we don't say a counselor, what we say is we say a team member. And they meet with the team member and they kind of provide an assessment and see if they might need some treatment and see if they're willing to be a part of the outpatient treatment or potentially inpatient. We also have a similar grant that is for the pediatric in the clinic, and that's BH2I, and it's kind of a similar situation. So they have somebody in the clinic, and that way if somebody is, potentially, needs treatment, then they're going to find that treatment. Another thing too is if anybody ever has any questions, feel free to call our main office. It's I can type it in the chat here in a minute. But it looks like Tyler just got his audio and his video back, so I'm going to turn it over to Tyler.
Sorry about that. My internet decided to just stop working on my laptop. So let me go ahead and pull this up. Alrighty, so hopefully everyone can see this okay. All right, so we know obviously that we're going through this global pandemic right now, and a lot of you may be asking if you have children, or if you work with clients who have children, you may be asking, this may be a question that comes up quite a lot, and that is, do I talk to my children or my child about COVID-19? You may be asking yourself, do I just stay silent and in hopes of not increasing anxiety in my child? Or you may ask yourself, are they old enough to understand even what's happening? And that's going to vary depending on the child's age or how far along they are developmentally or cognitively. And if so, what does that conversation look like? So let's kind of explore what that looks like here. So let's have the conversation. So have you ever asked yourself, when you're seeing your kid do something or say something, you may have asked yourself, like, how does my kid know about this, right? How do they come up with these things, or how are they aware of these kind of things? And that's because children's minds are like sponges. I mean, they are exposed to a lot more than what we think. So they've probably heard about the coronavirus or COVID-19 in some way, whether it was on the news or whether they heard their parents or adults in the house talking about it. So a good tip is to not be afraid to talk about the virus to your children. And what I talk about a lot anytime talking about mental health or any kind of problems that we may be facing in our lives, those problems don't just go away by not talking about it, right? They don't just vanish out of thin air just if we decide not to talk about them. It's really important too, if you are going to talk about them, to get the information from trusted sources such as the CDC or the World Health Organization. And then educate your children based on that information that we have today, because we know that the information regarding COVID-19 it seems like it's changing every single day. So make sure that you are talking to them and giving them updated information from trusted sources, from professionals. And again, I kind of echoed this a minute ago, but we want to make sure whenever we're having these conversations that we're speaking on their level. And it's important to kind of explore what they already know. So, I've asked my daughter, who is 7, what do you know about the coronavirus? And she knew that the Easter Bunny didn't come to our house. He didn't make an appearance this year because of the coronavirus. So he's been practicing social distancing. So that's what Natalie was told. And so that's kind of what she knows. And when I ask her, what does she know about the coronavirus? She knows that it makes a lot of people sick. And she may ask why she can't see her friends or why she can't go to school anymore. And that's because we're wanting to make sure that everyone stays safe during this time. It's also a great, having these conversations, allows us to educate our children too. So our children may say, I hear that once you get it, you're going to die. And that really makes me scared, right? So it's important that, we explore that conversation a little bit more and maybe say things like, well, not everyone does pass away when they get this. And again, speaking on their level is really important. My conversation with my 7-year-old daughter would be a lot different than maybe a 15-year-old. If you can remember a time when you were a teenager, you may think, I'm not scared of this virus. I'm invincible, right? Because I'm a teenager and I know that I am invincible. So that conversation is going to be a little bit different depending on the age. So keep that in mind. And it's always important that we're reassuring our children's feelings and really everyone's feelings that we're talking to about this. We want to make sure that we're giving reassurance. So if our children are scared, we want to make sure that we empathize with their feelings of being scared, right? And a lot of people are scared during this time, us included. But we want to try to make sure that our own anxiety doesn't increase our children's anxiety as well when we're having these conversations. It's also a great opportunity to reassure them that the virus is fairly rare and the symptoms are more mild in children from what we've seen from the data. And again, we're always empathizing with their feelings about not being able to see family, friends, or classmates. It's really tough for all of us, right? I know for me personally, I really miss hanging out with my friends, and I miss hanging out with my grandparents too, as most of us do. So being able to empathize with our children is going to really be helpful too. Just understanding, I get it. It stinks. It's tough for everyone, but we're going to get through this. And the way we ensure that people stay healthy and safe is by, practicing social distancing. And when we go to the supermarkets, we're making sure that we're wearing masks and we're using hand sanitizers and things like that. I also think it's important that we avoid promises that we may have no control over. So you may have a child say, well, when will I be able to go to the parks again? Or when will we be able to make that trip to Branson or Disney World or wherever it is you're going? I would avoid saying, oh, we'll go next month for sure, because we know that everything's going to reopen. So just making sure that we don't give false hope, because a lot of what we know right now is still kind of up in the air. We know that some states are slowly starting to do a soft open, but it is important that we don't make any promises that we really can't keep due to the uncertainty of everything. And we want to always ensure that, this is for the safety of everyone. So we can't go see grandma and grandpa because they're a little bit older, so they may be more at risk to getting sick, and we don't want grandma or grandpa to get sick during this time. And communicate. Kids want to know what's going on, right? Now, we want to be careful when we're communicating, especially if they're younger. We may want to stay away from kind of the doom and gloom and just come at it from a perspective of being more safe. We want to always make sure we're updating them on developments that are taking place. So this was an example, and we know that schools are closed down, but this is just an example. If a school in the county is closing down as a precautionary measure, this may cause a lot of children to feel very anxious because they may think, okay, the coronavirus is here and that's why the school closed down. So the coronavirus is, at our back door. Maybe I'm going to get it, so on and so forth. And we just want to make sure that we're taking these precautionary measures as a safety measure, right? It doesn't necessarily mean that you're going to get the coronavirus. This is just in the best interest from a public health standpoint. This is the best way to ensure that people stay healthy and safe. I want to talk about some resources too that we have. So shortly after COVID-19 happened back in March, late March, whenever it was declared a global pandemic, we decided to create the Behavioral Health Crisis Line, which I will actually pull up that flyer now so people can see that. So bear with me. Let me do this. Okay, so hopefully everyone can see this. So this is our flyer, and we have clinicians, licensed clinicians, who will speak to family members who may be experiencing anxiety, worry, stress, depression as a result of COVID-19, right? I know for me personally, my anxiety has been up a lot. You know, some of my coping skills may have involved going out with friends, or having friends just come over to the house and hang out, listen to music, watch movies and things like that. That was a huge coping skill for me. A lot of people, it's going to the gym, and now you can't go to the gym. I think some places are starting to do a soft open, but for the time being, you know, that physical fitness was their way of coping with just the day-to-day things we go through. So if anyone is experiencing, you know, any of those symptoms that I just mentioned, they can call one of our offices here. We have clinicians at Mulkey, Sapulpa, Coweta, Okemah, and Eufaula. So we're open from 8 to 5. So this isn't a 24-hour crisis line. I'll talk a little bit more about some of those hotline 24-hour, 7-day-a-week resources here in just a moment. Whoops. So we have the Creek Nation Behavioral Health Employee Stress Line. So if you are a employee from the Mvskoke Creek Nation, you can call 918-758-1930. I think there was a little bit of confusion when this number first came out that it was only for health employees, but it's opened up to all MCN employees. So if you're feeling stressed and you need somebody to kind of talk to, just kind of process some of those feelings, you need somebody just to empathize and reassure your feelings and what you're going through, we totally get it. Because even at behavioral health, we feel the same thing. We feel the stress of COVID-19 and everything that's happening too. So we're on the same page, and we're here to talk to you about that as well. We also have a wellness activity sheet that we've passed out to some community members already this week, and we'd like to share that document with you guys as well. I have it in a PDF, and I sent that to Nancy, and I think she's going to put that on the website. And it's really just an activity sheet that has different activities that you can do, or that families can do at home with their kids. So during this time, we really want to emphasize that family bonding, right? If you want to take what's happening with COVID-19 and turn it into a positive, you could say, okay, I have more time at home. And at first it may seem kind of stressful, but this may be an awesome opportunity to really rebuild and really connect with your kids and with your family a lot more, because you have more of that time together. I know for me, one of the things that my daughter and I do is we build Legos. So that's kind of what our activities have been lately, is a lot of Lego building. Mvskoke Language Department also hooked us up with this really cool coloring book. So I will send that out as well. It's a few pages of, I think the one that I sent out is different animals, and they're in Creek. So it's just another resource there, just a coloring book. We also have some COVID-19 information, kind of the latest information that we have. Again, that's in the PDF that we'll send on the website. The National Suicide Prevention Lifeline number, if you've ever heard me or Rush or anyone from Behavioral Health or even the Mvskoke Nation talk, you've heard us promote this number a lot. So that's 1-800-273-TALK. It's 24/7. So if you or somebody you know is having thoughts of suicide, please call that number, and they will help talk you through it and get you connected. There's also the crisis text line. You text the word Creek to 741-741. And I want to talk just briefly about the increase that we've seen with the crisis text line. So in February, there were 12 people that texted the crisis text line. And in March, there was 36. So March was right when COVID really hit. And then by April, there was 54. So we know that people are using this crisis text line. And we know that it's working for people. Here are just some other helpful websites as well. There's this link here, parade.com. It's things to do with your kids during the coronavirus or during quarantine. There is also this Choices Scholastic website here, and I put this on a PDF as well. It's going to be the website for kids PDF. So this link right here, one of our grants that we have has access and has a login with the Scholastic website. So there's different books for children on there as well, so it's free. And I put also the instructions on how to access that on the website for kids. And again, other websites to really make sure that you have access to and that you're keeping up with is cdc.gov, World Health Organization, and also ok.gov. Those are some really good ones. And again, the website for kids is going to be on a PDF file, which will be on the website. And because I got in kind of late, I didn't introduce myself, and I'm sorry, but my name is Tyler Stone, and I'm the project director for the Native Connections Grant. And we focus primarily on suicide and substance abuse prevention amongst 10 to 24-year-old Native youth. And I believe Rush and I are open to some questions, if anyone has any for us.
Yeah, if you have questions, please enter them in the Q&A box or the chat, and we can respond to those now. You guys did great presentations, really good information. Like Tyler said, we will get all of the documents that he referenced added to our website today, and I'll be giving you that link before we close out so that you can access those a little later on this afternoon. Oh, here we've got a question. How do you address youth who think COVID-19 is fake? I know the internet can both be our friend and enemy sometimes.
So that one's kind of tough, right? Because on one hand, you have social media that's telling you one thing, that it is, there's this kind of this push right now where it's a fake crisis, right? Again, I would reassure their feelings, and I would probably explore why they think it's fake and maybe where they're getting some of that information from. And I would also refer to some of the data that we have from as far as the death rates go, especially in Oklahoma. Those are going up every day. I know those are going to be updated in about 20 minutes, but I think yesterday was about 250, 240, somewhere in there. So from those numbers there, we know that it's not fake. But again, working with youth, where they get their information from, it could be social media, from their family, whoever it is. But maybe just talk to them a little bit more about it. Say, I get it. A lot of people think it's fake. But according to what we've seen in the data, and if you want to even explore even higher, and if you want to mention states like New York, where they're having a lot of deaths, I can assure you it's not fake. This is a global pandemic that's affecting millions of people. Just talk to them a little bit more about that. Hopefully that answers your question. It's tough. There's not a, every youth is different, and that conversation is going to sound a little bit different for everyone, but that's kind of the route I would take for sure.
I think for both of you guys, I just have a quick question, and you kind of touched on it already in your presentations, but I just want to really emphasize for everyone, what are suggestions that you have for parents, adults who just know a young person? If you see that young person is struggling, what would be the first thing that you would encourage them to do, and and then where to go with that if they're just really not even sure what to do?
So I think it always depends on your context, and I think it always depends on your case. But, there are certain situations where, it might seem easier to connect them to those resources. And then there are some of children that you might not know their parents, and you might not know their siblings. You might not know very many people in their life. And that might be a chance to maybe connect a local school, or even kind of maybe reach out to, if you know they go to a certain church, or if you do know their parents, see if you can go ahead and give them a phone call or just stop over. I know it's not always a smooth conversation, and it's kind of, you really kind of have to get out of your comfort zone sometimes to go and just to talk to them, to say that, you know, you're concerned about their child, or maybe you're kind of seeing these things. And trust me, I've had a lot of conversations with people, and it's not always receptive. But I know at the end of the day, as long as we're continuing to reach out and to continuing to support them, and maybe even just grab a couple brochures and just say, hey, I know that, you may not want to talk about this, but here are some brochures, and they have some helpful information, helpful phone numbers. I would consider maybe reaching out to them. And, oftentimes it goes okay. But even just learning about these webinars, and that's another way that you can kind of introduce that conversation and say, well, I was actually listening to a couple speakers the other day, and they were talking about, if somebody only wants to sleep and they're, kind of saying things that are kind of alarming, I would encourage you to maybe think about reaching out, and here's the phone number for you. So every conversation is going to look a little bit different, and some individuals aren't going to be as receptive and some are. So I think it's just our job to continue to try to reach out and to try to continue supporting that treatment, because again, like I said, mental health is just as important as physical health. So I hope that answers your question, Nancy.
Yeah,
definitely.
I think that's, everything Rush said is spot on. And anytime in the conversation, if you can find a way to normalize that help-seeking behavior, right? Say it's okay to get help for this, right? And we know that there's still that stigma, right? Because if I break my leg, or I had to go to the doctor the other day because I had a gash in my head, and I won't explain the story here because it's very embarrassing and I don't want to do that. But I had to go to the ER, and I didn't even think twice about it. I went to the ER to see if I needed stitches or not. But and most people wouldn't even hesitate, go to the ER, because there's no stigma surrounding, I hurt my head, right? I have blood coming out of my forehead, I need to get some stitches, right? But if I was experiencing anxiety or depression, and this had been going on for a long time, there would be some of that hesitation, right? Going out and getting help, speaking to a therapist, right? Having to open up and be vulnerable about the things that are going on in my life. So it's my hope that we just get to a point where, like Rush said, that mental health and physical health are just as important, and they're the same, and they coexist with one another. So tying in that conversation too. And if you yourself have been to therapy and you're talking to somebody who may think therapy can't help me, that's only for quote unquote crazy people, then just say, I went to therapy and I thought it was really cool, right? Any way you can normalize it into the conversation, I think is gonna be really helpful as well.
Good deal. Yeah, I definitely think that's important also. It doesn't look like we have any other questions for you guys, because you did such a great job giving out the information already. But we do want to thank Rush and Tyler for being with us to celebrate Children's Mental Health Day. I want to thank everyone who was able to attend. Please definitely share the information, reach out to a young person in need. I'm going to show you our contact information. If you need to reach our office or anything like that, we can get you back in contact with behavioral health if you need them to. Got our phone number there, website, email, and then also we are on social media at Mvskoke Youth. So you can find us in all those different ways. This presentation will be posted later on today, as well as we'll have the documents that Tyler referenced on our website later on this afternoon too. Thanks again. Have a good day.
Thank you.
Thank you. Thanks for having us.